You're watching EAC News. Thanks for joining us. The outbreak of coronavirus disease, or COVID-19, was first reported from Wuhan, China on 31st December 2019. The COVID-19 pandemic has led to an increased demand for single-use plastic that intensifies pressure on an already out-of-control global plastic waste problem. While it is suspected to be large, the magnitude and fate of this pandemic-associated mismanaged plastic waste are still unknown.
Discarded syringes, used test kits, and old vaccine bottles from the COVID-19 pandemic have piled up to create tens of thousands of tons of medical waste, threatening human health and the environment, a World Health Organization report has said on Tuesday. The recent COVID-19 pandemic has led to an increased demand for single-use plastic, intensifying pressure on this already out-of-control problem. This work shows that more than 8 million tons of pandemic-associated plastic waste have been generated globally, with more than 25,000 tons entering the global ocean. Most of the plastic is from medical waste generated by hospitals that dwarfs the contribution from personal protection equipment. This poses a long-lasting problem for the ocean environment and is mainly accumulated on beaches and coastal sediments. The material, a portion of which could be infectious since coronavirus can survive on surfaces, potentially exposes health workers to burns, needle stick injuries, and disease-causing germs, the report has also said. Communities close to poorly managed landfills can also be affected through contaminated air from burning waste, poor water quality, or disease-carrying pests, it has added.
One of the really important findings is that we found that COVID-19 has increased healthcare waste loads in facilities to up to 10 times current volumes. If you consider that 2 in 3 healthcare facilities in the least developed countries didn't have systems to segregate or safely treat waste before the pandemic, you can just imagine how much burden this extra waste load has put on healthcare workers, on surrounding communities, especially where waste is burned with the release of dioxins and furans. In terms of volume of waste, we actually found that gloves were a bigger volume than masks, which is rather interesting given that gloves are, for the most part, a non-essential PPE for COVID. So that is an obvious area where we could reduce waste. Overall, the vaccine waste is now taking over PPE waste in terms of volumes, just because there's so many vaccinations happening, which is a good thing. So we're not obviously recommending that we reduce vaccinations or reduce the essential PPE. But in terms of the risk of waste in COVID, it's quite low from what we know about the virus and its survival in the environment. It's really other risks in the healthcare waste, especially when waste is not segregated. Typically about 80% of waste is non-infectious, but if you're not segregating, you potentially are contaminating all your waste.
The report calls for reform and investment, including through the reduction in the use of packaging that has caused a rush for plastic and the use of protective gear made from reusable and recyclable materials. It estimates that some 87,000 tons of personal protective equipment, or PPE, or the equivalent of the weight of several hundreds blue whales, has been ordered via a United Nations portal up until November 2021, most of which is thought to have ended up as waste. The report also mentions some 140 million test kits with the potential to generate 2,600 tons of mostly plastic trash and enough chemical waste to fill 1/3 of an Olympic swimming pool. In addition, it estimates that some 8 billion vaccine doses administered globally have produced an additional 144,000 tons of waste in the form of glass vials, syringes, needles, and safety boxes.